Never think hard about the past. It brings tears in your eyes. Don't think more about the future. It brings fears. And live this moment with a smile. It brings cheers. So enjoy the life as much as you can. Now, coming to the diagnosis of the sciatica, it is based on history, physical examination, and medical imaging. First, we will discuss the history and the physical examination. A person reports typical radiating pain in one leg indicate nerve root tension or the neurological deficit. Mostly used diagnostic test is straight leg raising test to produce Lassig's sign positive if pain in the distribution of the sciatic nerve is produced with passive flexion of the straight leg between the angle of 30 to 70 degree. It is positive in 70% of the people with sciatica and 70% people with a positive test sometimes do not have sciatica. Here one can see radiation of the pain in the positive test is when it is going to be raised at 30 degree there is pain in this region, and when it is being raised up to the 70 degree the person is having a pain in this region. So this is the positive test. And what happens when in this straight leg raising test, that it is going to compress the spinal cord and the bulging disc that is at the nerve number 3 and number 4, which is causing pain in this distribution of blue in the leg. Now, straight leg raising of the normal unaffected leg by the sciatica produce sciatica in the affected leg. If the straight leg raising is done on the normal, which is not affected leg, there that produce sciatica pain in the affected leg. It is called Fager-Stan sign, and it is more specific finding for a herniated disc than the LASIK sign. Maneuvers that increase intraspinal pressure like cuffing, flexion of the neck also produces the pain. Bilateral compression of the jugular veins worsens the sciatica pain, and check muscle strength and the reflexes, and while walking on the toes or the heels rise from the squatting position that also causes pain. So these are all the tests and the examination for the diagnosis. Now, the other part of the diagnosis is medical imaging, and it include X-ray, CT scan, MRI, and that is other is number 2, MR neurography, number 3, electromyography, EMG, and number 4, discography. First, we are going to discuss X-ray, CT scan, and MRI. Mostly medical imaging is not needed. An X-ray of the spine showing an overgrowth of the bone or the bone spur pressing on a nerve, computerized tomography, CT scan, or magnetic resonance image MRI to diagnose the lumbar disc herniation. As one can see on the X-ray, there is, one can see the bulging of the disc through these vertebra bodies, and here one can see on the CT scan more clearly the disc is bulging and it is pressing on the spinal nerves. And CT myelogram that is sometimes being used, that a dye is injected into canal and that just going to realize that it is vertebral body and normal disc, and here there is the herniated disc that is being shown very clearly by the CT myelogram, and in MRI one can see clearly the structure, as one can see this vertebra, and that is the herniated disc causing the bulging and just pressing on the nerve and causing the distortion of all the normal structure. Now, in CT scan, with contrast dye injected into the spinal canal before X-ray are taken, I have already shown you the diagram of CT myelogram. This is a procedure called CT myelogram. The dye then circulates around the spinal cord and the spinal nerve, which appear white on the scan. In MRI, a powerful magnet and the radio waves are used to produce cross-sectional images of the area, and it produces detailed image of the bone and the soft tissue such as the herniated disc responsible for sciatica. The number two in imaging is MR neurography, that is used in the diagnosis of the piriformis syndrome, as one can see the MR neurography, that is just showing the different branches of the sciatic nerve, and there is L4, L5, and here also the sub branches of that can be seen, and here these are the images which can tell where the problem is, and when this nerve is coming out from the piriformis muscle, it is just going to show the path of that. Then electromyography, it is the stimulating electrode to the muscle, and the muscle contraction and the movement that is being recorded by this electrode, and this machine that is just going to measure the nerve conduction, and that is going to tell about the function of the muscle, whether they are doing normally or not. So this is electromyography. It measures electrical impulses produced by the nerves and response of the muscles. This confirms nerve compression caused by the herniated disc and also the narrowing of the spinal canal or spinal stenosis. The fourth in the diagnosis of the medical imaging is discography. It determines a specific disc's role in the pain. It involves insertion of a needle into a disc to determine pressure of the disc space. Radio contrast is now injected into the disc space to see the visual changes in anatomical abnormality of the disc. The reproduction of the pain during the discography is also diagnostic of the sciatica. So here one can see discography, the needle is being injected, put into the disc, and then the injection of the contrast media is put into the nucleus pulposus of the disc, and then it is being measured and read by the computer operators, and here are the results of the discography. One can see the result of the discography here also, that tells the disc properly and its space. Now, the differential diagnosis of sciatica, number one is the cancer like epidural tumor. It should be suspected if there is previous history of it, or there is unexplained weight loss or unremitting pain. So do magnetic resonance imaging to confirm the cancer. The other differential diagnosis is spinal epidural abscess. It is common in those with diabetes mellitus or immunocompromised person who had spinal surgery, injection or the catheter, it causes fever, leukocytosis, and increased ESR. So do urgent magnetic resonance imaging or MRI to rule out this. The third is shingles. It is seen in elderly and immunocompromised. Pain is followed by a rash with small blister along a single dermatome. So it is having dermatomal distribution of the rash, which is just going to tell that shingles or herpes zoster is there. Sometime pain without the rash and the blister is there. So keeping in mind the dermatomal distribution pattern. So here one can see the epidural tumor, which is just pressing the spinal nerve roots, and also spinal epidural abscess, which is also pressing on the spinal cord, causing the problem. And here is the dermatomal distribution of the shingles along the nerve. So that also gives the pain like sciatica. Then proximal diabetic neuropathy, it affects middle-aged people and the older people with well-controlled type 2 diabetes mellitus. Its onset is sudden, causing pain in the multiple dermatomes quickly, followed by the weakness of the area. Diagnosis involves electromyography and lumbar puncture. Then fifth differential diagnosis is acute Lyme radiculopathy. The patient have a history of the outdoor activities during warmer months in the area which is having the likely tick habitat. There is an expanding rash accompanied by flu-like symptom, and the Lyme can also cause a milder chronic radiculopathy after 8 months of acute illness. So here one can see the proximal diabetic neuropathy. If the number 4 is involved, the pain will be in this area, and if there is number 5 involvement, the pain will be up to the foot at this area, and if there is S1 involved, sacral one, the pain distribution will be up to the foot, and from this pattern of the pain, one can just check the diabetic neuropathy. Now, in acute Lyme radiculopathy, one can see this kind of rash here on the chest wall and here on the leg. So that is also giving the clue of Lyme radiculopathy. This is look like to be an animal with the wings and going to attack you, but it is basically the beauty of the flower made by the God Almighty. One can't believe that the flower can be like this, opening his mouth like any animal, but actually it is a beautiful flower. Now, the management of the sciatica, our goal is to restore normal functional status and the quality of life of the patient when the cause is lumbar disc herniation, as it is about 90% cases, they resolve spontaneously. Initially, treatment is conservative, and the 75% of the patient who are going to cure by the conservative treatment, they do not need any kind of surgery. So ask the patient to stop smoking so that to promote the healing. Treat the underlying cause of the nerve compression in cases of the epidural abscess, epidural tumors, and cardiac vena syndrome. Now, the treatment has been classified and that has been made in 6 parts. That is, number 1, physical therapy, medication, botulinum toxin injection, local epidural steroid injection, and 5th is surgery and alternative medicine. Number 1, first we are going for the physical therapy. As the conservative management, for the person who are physically able to do this physical activity and can have this therapy. There are certain exercises to correct the posture, strengthen the muscle, supporting the back, and improve flexibility by the weight training in the gym. Now, physical therapy includes exercise, yoga, physiotherapy, use of the appropriate bed and the sitting cushion, etc. Nerve mobilization technique for the sciatic nerve are effective. The evidence of the physical therapy is not very clear. Number two part of the treatment is medication. No one medication is superior to the other to treat the sciatica. Use of the opioids and the muscle relaxant is not very encouraging and it is just poor. Non-steroidal anti-inflammatory drugs do not improve immediate pain and all non-steroidal anti-inflammatories are nearly the equivalent. One can use any one of them, diclofenac, sodium, naproxen, lornexicam and other molecules which are part of the non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs are given as a first-line treatment to have the relief from the pain. Now, the physical therapy, as one can see, the different kind of exercises which are being used, head to knee, then eye of the needle and the bridge and one leg pigeon, and that is the different names that have been given to the exercises, and one can see that exercise according to the diagram that is going to strengthen and just have relief from this sciatic nerve. Low evidence supports use of the gabapentin as the part of the medication treatment. Anticonvulsants and biologics not improve acute or the chronic sciatica. Antidepressants are sometimes effective for individuals non-responsive to non-steroidal anti-inflammatory drugs or the failed non-steroidal anti-inflammatory therapy. The patient is not able to tolerate it. Third kind of treatment is botulinum toxic injection. If the sciatica is due to piriformis syndrome, botulinum toxic injection improves the pain and the function of the muscle and ultimately give relief to the sciatica. So here one can see Botox treatment that is being given to the piriformis muscle by this needle and to inject the botulinum toxin to get relief of this piriformis syndrome. And here one can have epidural steroid injection, and that is also going to allay the inflammation and causing the relief from the pain. And here is that injection epidural which is given to the patient back. Now, number 4 is the local epidural steroid injection. As I have already shown you, little evidence support the use of epidural or the systemic steroids. Local steroid injection into the area around involved irritated nerve root to suppress the inflammation is more effective, and given individuals with confirmed disc herniation and those with the contraindication to the non-steroidal anti-inflammatory drugs, so one can go for the local epidural steroid injection. The 5th treatment is the surgery. If the pain is severe and still lasts, surgery is a last option. It speeds pain improvement and gives relief immediately from the pain. It is reserved for the compressed nerve, causes significant weakness, loss of bowel, or the bladder control, or the severe pain. So surgery is the only option. So here one can see the lumbar discectomy, the part of the this disc which is compressing on the nerve root. So this is being dissected and it gives the relief and the pressure on the nerve is relieved and the pain is relieved. Similarly, this is the lumbar vertebra and the herniated part of the disc is removed as one can see this part which was impressing, pressing or impinging on the nerve that is being removed and there is relief as there is no pressure here from this herniated disc. Sometimes the laminectomy is done and that is as the lamina of the vertebra is just released so that there is more space for the spinal cord to work, as in case of the spinal stenosis there is a narrowing of the space and the canal and that is just relieved by the laminectomy by just cutting the lamina of the vertebra. Now, continuing the surgery, that is to remove the bone spur or the portion of the herniated disc, pressing or the pinching the spinal nerve, disc partial or the complete removal called discectomy or discectomy by the endoscopic microdiscectomy is done if cause is spondylolisthesis or the spinal stenosis. Surgery provide pain relief as I have already shown you, that is by the laminectomy, vertebroplasty for the cleft vertebra or the osteoporosis repair is done to strengthen the vertebra and to just do the cementing of the vertebra to give strength to the vertebra. The sixth part of the treatment is alternative medicine, spinal manipulation done by chiropractors is an effective treatment for the acute sciatica in some cases. And here it is lumbar discectomy, this disc in between the lumbar vertebra that is being removed and that is not impinging on the spinal nerves as one can see here. And so here there is fractured vertebra and the cement is injected into the fractured vertebra just to gain height and not going to have effect on the disc which are upper and lower. So this is called cementing of the vertebra. Here there is also the vertebroplasty, the repair of the vertebra and the damage done by the osteoporosis that is going to cause the osteoporosis repair. The cement is injected into the fractured vertebra and the cannula passes through the skin and to the pedicle of the vertebra to just put some cementing material and to give strengthen this. Now, the sixth treatment is alternative medicine, that is to treat restricted spinal mobility. They restore spinal movement, improve function, and decrease pain. It is found safe for the treatment of the disc-related, but this causes cauda equina syndrome. So, contraindicated if progressive neurological deficits is there. It is an effective treatment for acute sciatica, but not for the chronic sciatica. It is effective and safe for the low back pain, but not for the radiating pain in the leg. Other treatments which are being used for the sciatica relief are acupuncture, heat, or the ice pads. All have limited or the poor evidence for their use. So here one can see the chiropractic procedure giving relief and just manipulating on the back. Similarly, on the leg, and the acupuncture, the putting the needle on some special points to give relief from the pain. So these are the needles of the acupuncture. Now, lifestyle and the home remedies. Cold packs placed on the painful area for 20 minutes several times a day also give some relief. Use an ice pack or a package of the frozen peas wrapped in a clean towel to apply on the affected part. Then hot packs apply heat to the area that hurt. Use hot packs, a heat lamp, or a heating pad on the lowest setting first, then increase gradually according to your need. If still pain, try alternating warm and cold packs. The next lifestyle and home remedy is stretching. Exercises for the low back might relieve nerve root compression. Avoid jerking, bouncing, or twisting during the stretch. Hold stretch for at least 30 seconds. Now, coming to the prevention from sciatica pain. Number one, exercise regularly to keep the back muscles strong. Pay special attention to the muscles of the abdomen and the lower back. It is essential for the proper posture and the alignment and relief of pain. Number two is maintain proper posture while sitting. Choose a seat with good lower back support, armrest, and a swivel base. Placing a pillow or rolled towel in small of the back to maintain its normal curvature. To avoid the injury to the curvature, keep the knees and hips level. Number three, use the good body mechanics. If to stand for the long periods, rest one foot on a stool or small box from time to time. To lift something heavy, use the lower extremities to work more. Keep the back straight and bend only at the knees. Hold the load close to the body and avoid lifting and twisting simultaneously. Find a lifting partner if the object is too heavy or awkward and one cannot lift alone. So that is the end of the lecture, and I hope you may have liked this lecture. I have given as much as possible in this lecture. There are certain books which have been written on this subject, but I have tried to give maximum possible in this lecture. If you like so, then please subscribe my channel. And if you have any question, you can ask me at my number given here. And thank you for watching and to be with me. Thank you.